Cancer is abnormal proliferation and growth of cells, and cervical cancer is a type of cancer that occurs mostly in the women. And 70% of cervical cancers are caused by the human papillomavirus. Before we begin, I am pharmacist God's Gift, and on this my channel, I talk on health matters. I give possible information on drugs that you can use for your health and also your skin. So if you are the type that is interested in health talks like health matter, please, I would like you to click on the subscribe button, okay, and put on the notification bell so that you'll be the first to get notified on any of my new videos, okay. And if you like this video, like you are interested in knowing more about cervical cancer and also the preventive measures for cervical cancers, please, I would like you to like this video, because right on this video I'm going to tell you the causes, the symptoms, and also the best possible preventive measures that you can use for cervical cancer, okay. And as a woman, this video is made right for you, so you need to stay tuned till the end, and don't forget to share this video to everyone out there. The human papillomavirus is a type of virus that causes cancer, okay, and mostly it causes cervical cancer. And 70% of cervical cancers that occurs in women worldwide have been found to be caused by this human papillomavirus. And this virus is acquired through sexual intercourse, okay, it's transmitted through sexual intercourse. So you have to have sex before one can pass this human papillomavirus to the other partner, okay. And this human papillomavirus also occurs in the male, but it does not cause cervical cancer because they don't have cervix, okay. So now for the female, it ends up causing cervical cancer. Then other causes or other persons that are risk factor to this cervical cancer are those that uses old sanitary pads, okay. There are some persons that tend to use wrappers or some napkins that are not clean that they reuse. They have high chances of coming up with cervical cancer. Then also those that have had previous infection, that are used to having sexually transmitted infection, are at high chances of coming up with cervical cancer. Then thirdly, those persons that have HIV virus are high chances of coming up with cervical cancer. That is to say that HIV virus too can predispose one to cervical cancer. Then fourthly is those that have had genital warts previously. If you know that you've contacted genital warts before, you should be very careful and treat yourself immediately, because you are at high chances of having cervical cancer. Then fifthly, those that started having sexual intercourse at early age, okay, or those that got married at early age and start having sexual intercourse, those persons are very high chances of coming up with cervical cancer, okay. So now what I'm trying to tell you is the causes and the risk factor. Also, those who smoke cigarettes at high chances of coming up with cervical cancer. Then finally, those persons that abuse oral contraceptives like your Postinor 2 and your Postinor 1, you are high chances of coming up with cervical cancer. So if you are the type that you abuse contraceptives, like you abuse oral contraceptives, this is the time to wash yourself and reduce how you abuse it, or even stop totally how you abuse oral contraceptives, because it predisposes one to cervical cancer. Now that you've known those that are at high chances of coming up with cervical cancer and the major causative agent, which is the human papillomavirus, now what are the symptoms of cervical cancer? To the ladies, how will you feel to know that you have gotten or you have contacted cervical cancer? The major symptom, or the number one symptom of cervical cancer, is abnormal vaginal bleeding, okay. You will notice that you will bleed for no reason. It is not your monthly flow. That is to show that you have cervical cancer. Then secondly is what? Bleeding after sexual intercourse, okay. When you have finished having your sexual intercourse with your partner, you notice that you're bleeding for no reason. You need to go carry out tests immediately, okay. Then thirdly is bleeding after menopause. Okay, mostly after menopause, you're not expected to bleed or see your monthly period. Okay, but if you're the type that you notice that you're bleeding when you have reached menopause or after your menopause, please you should go and carry out 1 or 2 laboratory tests. It might be that you have cervical cancer. Then finally is increased vaginal discharge. Okay, your usual discharge that you have, sometimes when you have infection, sexually transmitted infection, you will have discharge. Okay, but when you notice that this discharge comes out and you are even noticing vaginal bleeding, abnormal vaginal bleeding when it's not your monthly flow and you are having increased discharge, please you should rush go carry out some laboratory investigation to check if you have been infected with this human papilloma virus, okay, that causes this cervical cancer, so that you can find possible way to treat it immediately. So these are the major signs and symptoms I would like you to look out or check out in your body as a woman to know if you have been infected with this human papilloma virus that causes this cervical cancer. That is it about the causes and the symptoms of cervical cancer, and even those that are at high risk of coming up with cervical cancer. So if you have been following me till this point, please I would like you to like this video and subscribe to my channel. Give it a thumbs up. Okay, now let's continue. Let's look at preventive measures. Yes, we need to know the preventive measures of this cervical cancer, of this human papilloma virus. Okay, the main goal of this prevention of cervical cancer is to reduce the death rate and also to reduce the rate at which women come up with cervical cancer. So the best and the first, or let me say the primary way to prevent this cervical cancer is to prevent yourself from being infected with this human papilloma virus. You get? Because this human papilloma virus is the causative microorganism, or let me say the causative agent to this cervical cancer. So the second point is human papillomavirus vaccination. Okay, you have to immunize your girl child. The girl child needs to be immunized at the ages of 9 to 14 with this human papilloma vaccine before they start having sexual intercourse. Okay, like in this rural area, like the northerners, those persons that that give out their young children in marriage so that they will be vaccinated against this human papilloma virus. So remember, I said the first thing is to prevent this human papilloma virus from getting into your body. And how can you do that is to what? Vaccinate yourself against this virus. The third way to prevent cervical cancer is a health education. Okay, health education on both the boys and the girls. Okay, now it has to do with both the boys and the girls to promote safe sex with the use of condom so as to prevent human papilloma virus and other microorganisms or other bacteria or viruses from infecting each other. Okay, fourthly is screening of all women who are at high risk of cervical cancer. Okay, hospitals, you have those that are HIV patients that come for their drugs and their treatment. Those persons that have HIV, that there are high chances of having what? Cervical cancer. So at the early stage where they have been detected of having this HIV virus, they should go and screen themselves for cervical cancer at least 3 times in a year first, okay, before you will now do it annually, like every year. You can now do it once every year to make sure that you have not been infected with this human papilloma virus. Also, fifthly, if you are the type that you smoke and you've gotten genital warts before, you need to screen yourself also, because you are at high risk of having human papilloma virus that causes cervical cancer. Okay, also, if you know that you are the type that when you're on your period you don't have good sanitary practices, please I would like you to stop that. The pads are meant to be changed every 4 to 6 hours, at least 3 times a day. Is not too hard, morning, afternoon and evening, so that you can prevent cervical cancer or even other infection, because most people do usually have infections when they finish seeing their period. Okay, Then finally, for this video, I will say that community mobilization programs like education of the female, education of the male also should be carried out in our local communities, okay? Our governors, our community leaders should try to encourage, community awareness programs, education programs on these cervical cancer issues, because it's becoming thing of the day. Every year, numbers are counting of the cases of cervical cancer that have been recorded. We need to educate the female child on the dangers of early marriage, on cervical cancer and other sexually transmitted infection or diseases. And also, the male too should not be left out because they are involved. This and many more are the ways that you can practice to prevent cervical cancer. Please, to all our ladies, practice safe sex so that you won't come up with human papillomavirus that causes cervical cancer. I hope this video has been educative and helpful to you. Thank you for staying tuned till the end. See you next time in my next video. Bye.